I'll be talking to you about an inhaler recycling pilot project that is due to start in the Up Valleys cluster. The project has been driven by Nikki Watts, who's the lead pharmacist for the cluster. And we are really pleased to be the first in Wales to lead on this pilot, and have already started supporting other health boards in planning to implement similar schemes. And Welsh Government will be analysing the results for a potential of an all Wales rollout, but obviously that is dependent on the results of our pilot. So just to give some background information, Richard did touch on some of this in his presentation, but metered dose inhalers contribute to 3.5 to 4% of the carbon footprint of the NHS, and medicines as a whole account for 25% of the carbon footprint. If sent to landfill, the main propellant used in the inhaler, the HFA 134A, can leak out of the inhalers, which is harmful and contributes to global warming. As part of Swansea Bay's decarbonisation action plan, there's an objective to recycle at least 80% of all inhalers by 2025. And Nikki Watts, the lead pharmacist in the Upper Valleys cluster, has identified the need for responsible inhaler disposal and has been fundamental in driving the pilot. Nikki and his colleagues in the Upper Valleys cluster did do some background research of just patient behaviours and what they were currently doing with the inhalers after use. He did find that 90% of users within the cluster dispose of the inhalers in general waste, which is a huge amount, especially if the figure is consistent across the health board in terms of other clusters and hospital sites, but also across Wales as well. So there are two parts to the inhaler recycling. The inhaler returns and the recycling itself, as we firstly need patients and caregivers to return their inhalers to the pharmacy as standard practice before we were able to recycle. The cluster started an inhaler returns campaign in one pharmacy in October last year, and this has been ongoing, where patients are encouraged to return their inhalers to the local pharmacy for responsible disposal. As part of this, Nikki and his team collated some initial patient surveys, and from 40 respondents, as you can see, 47.5% dispose of in general waste, 40% dispose of plastic and household recycling and other parts in general waste, and 67.5% are not aware of the environmental impact of responsible inhaler disposal. What's encouraging is only 10% returned to their local pharmacy at present when it was undertaken in October. 97.5% of respondents would be willing to return the inhalers. So as part of the inhaler returns campaign, Nikki and his team have been educating patients to dispose of inhalers responsibly. Pharmacy staff add stickers to the inhaler packaging, acting as a prompt, and also advise patients or caregivers or families of patients to return the inhalers to the community pharmacy for appropriate disposal. Just to provide some data, as you can see, the number of inhalers that have been returned to the pharmacy by patients to date is encouraging, as there's an increase in returns from October 2021 to last month. Albeit there are some dips, but it is encouraging, it is an upward trend. During this period, a total of 293 dry powdered inhalers were returned, and 956 meter dose inhalers were returned. So in total, 1,249 inhalers were returned to one community pharmacy. We are currently awaiting approval to roll out the inhaler returns campaign across all clusters within our health board. This is being led by my colleague Amy David, who is a primary care pharmacist, and hopefully we'll be able to see a encouraging increase in the returns when this does start. So as part of the inhaler returns campaign and the inhaler recycling pilot, both staff and patient communication and engagement are key. Working with both Nikki and Amy, we're looking to increase patient and staff education on responsible inhaler disposal and promoting the inhaler recycling and returns. We're also developing patient-facing videos and other communications that can be shown in waiting rooms and within the pharmacies themselves, just to make patients aware of the environmental impact that inhalers do have. We'll also, we have started to increase social media coverage regarding the scheme. All of these, as well as word of mouth, will raise awareness. We as we look to drive the change in patient behaviour, just so that it becomes second nature for the patients to return the inhalers to the pharmacies. So currently, with the inhaler returns campaign, the inhalers are incinerated, which is better for the environment than going into landfill. But we have identified the need for the recycling scheme. We submitted an application as part of the Health and Social Care Climate Emergency National Programme Funding Scheme to apply for funding for the project, which we're pleased to say we've secured through Welsh Government. Grundon Waste Management have been identified as a company that are able to recycle the inhalers, and it is planned that Grundon will collect from one central point within the cluster in order to take back to their processing plant in Gloucester. Each pharmacy will be provided with a bin. The bin will be collected every 6 months and can hold 1,500 to 2,000 inhalers. We're also working with an organisation called RAP Cymru, who are a Welsh Government funded not-for-profit group, who ensure resources are kept in use for as long as possible to see if other parts of the inhaler can be used in other products, such as furniture. I think it's important to know that even though Grundon are recycling the materials, as a health board, we need to know exactly where the materials are going, as it would be slightly defeating the object of the recycling if they're being flown abroad for recycling or disposal there. By ensuring sustainable materials management, the HFA gets reused in refrigeration. The aluminium is supplied to a local metal processing facility to be recycled, and the plastic case is absorbed in other plastics within Grundon, then supplied to approved partners within the plastic recycling industry. We did look for companies that were closer to the health board within our local and immediate area. However, Grundon were the only company that were suitable for what we needed, as they are able to process the HFA gases as well. So we're also working on other decarbonisation initiatives across all 8 clusters within the health boards, many of which Richard just discussed. These include focusing on prescribing low global warming potential inhalers, respiratory reviews in primary care, asthma and COPD clinics, ensuring correct inhaler use technique and the appropriate use of spacers, and also switching inhalers from Ventolin to Salamol where safe to do so and will not impact the patient. As you can see from the diagram, 10 puffs of a Salamol inhaler are equivalent to 6.25 miles in the car, as opposed to Ventolin, where 10 puffs is equivalent to 17.5 miles. As expected, this is an area we must focus on, but there have been concerns raised by patients that it is a cost-saving exercise and not in the interest of the environment. However, it's often the case that it does cost us more, especially when switching from MDIs to DPIs. And if there are any questions, I'd be happy to answer them in the discussion or the chat, but I have put my email here as well. So if you do have anything, you can send them across and I'd be more than happy to answer. Thank you.